Hello, good evening. How are you? How you day? Welcome to another session of Ask the Doctors. My name is Dr. Frederick Unwibohai. People call me Dr. Fredostar. And I always tell you good life na sense. Yes, for those who don't know, I'm a licensed medical doctor and I'll be the host of this program. My co-host is Dr. Israel Robonose. Now we do this program every Sunday from 8 p.m. Nigerian time to 9 p.m. and we don't dey do am for over 4 years now. Today on the program, we dey talk about the menstrual cycle. Today we wan talk about the menstrual cycle. Many women no know about the menstrual cycle. When you ask them, Madam, wetin be the length of your menstrual cycle? She go say, I no know. My menstrual cycle na 2 days, 3 days. So today on this program, we wan break am down for you so make you know wetin e mean. If you dey watch me on Facebook or you dey watch me on YouTube, you dey welcome. No forget, share this video, make more people come learn. Yes, I can see say we get people already. Mercy, how are you? Sophie, good evening. How are you, Sophie? How you dey? Welcome, 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 welcome. Now, before I start, if you know the length of your menstrual cycle, or if you know wetin menstrual cycle mean, put am in the comment section. Oya, tell me wetin you understand by the word menstrual cycle. What do you understand by the word menstrual cycle? Oya, no forget, share this live session. Make more people come watch. Share. What do you understand by menstrual cycle? I dey wait for you. Before Dr. Israel go come here, I want make you tell me wetin you understand by the word menstrual cycle. I dey live on TikTok, though my TikTok live later I go soon end the TikTok live when Dr. Israel come online. I go end them. But for now, Cynthia, how are you? Iniobong SCN on YouTube. Iniobong SCN, how are you doing? So tell me, what do you understand by menstrual cycle? Oh yeah, let's go. Taka Arists, how are you? CC on TikTok say menstrual cycle means menstruation. Is she correct? Is she wrong? We'll find out. Oh yeah, tell me, when you hear the word menstrual cycle, Veronica, waiting come to your mind now. Oh baby, tell me, Mr. Man, yes, even some men no know wetin be menstrual cycle. A man go marry wife, e no go know whether im wife get 28, 30, 3, 4. E no understand anything. Oh yeah, good. Somebody is answering my question on Facebook. Is it Facebook? No, on TikTok. Let me take one comment on TikTok. Man, take am. You see, menstrual cycle means the number of days it takes from one cycle to another. This person, be like this person go school. Okay, she's not correct. Comrade Shehu, how are you? Everybody share this video. Another person on TikTok, ma read again. He say it's 4 phases. Somebody on TikTok says the calculation of the first day of your period starts to the next period. Okay. Ladies and gentlemen, mommies and daddies, oh babies and my G's, my guy, Alpha. Menstrual cycle, wetin e mean? Oh yeah, make I break them down for you now. I won't start the menstrual cycle. When you born pikin, you born girl, or you born female. When you born female, the pikin go dey grow normal, go dey grow normal. E get one age where the pikin go come reach like this. When the pikin reach that age, the pikin go come start to dey see period. E don enter puberty. True or false? Yes, now I go lie for you. Now so e be. E go enter that phase where she go come dey see period. Abi? Very good. You go see wetin? You go see period. Okay, Dr. Israel, they follow me charts. Okay, Dr. Israel, they follow me chat. I dey wait for Dr. Israel. Where is Dr. Israel? Now, menstrual cycle. When a woman starts to dey see her period, number one, she go dey hear the word menstruation. Sometimes she go say, "Mommy, oh, blood dey come up my body. I no understand." Go dey fear. Later, they will come explain to am. Woman, when you see your period, when your period starts for 1 month, that month pass, you can't enter another month. You can't see period again for that second month. The number of days wey e take happen from that first period for last month to the new period of this month, the number of days, na im be the length of your menstrual cycle. Oh. Na im be length of menstrual cycle. Na im be length. Dey follow me? When you see your period for last month na August, this month na September. So if your period start 10th of August, you can't see your period on the 7th of September. The length of the menstrual cycle. Now, from that 10th of August, you go count, can't enter this period, this month on. You can't count them. That be length. But the funny thing about menstrual cycle be say many things they happen inside menstrual cycle. After woman see period finish, some go see period for 1 day. E no dey normal to see period for 1 day. 1 day period is abnormal. But 2 days period for some women, it is normal. Some go see period for 3 days. Some go see period for 4 days. Some go see period 5 days, 6 days, even 7 days. It still dey normal. So when you see your period from between 2 to 7 days, that one dey normal. That be menstruation. Okay, Dr. Israel is in the house. Dr. Israel, don't come. Make I bring up Dr. Israel. Dr. Israel is in the house. Dr. Israel, good evening. How you dey?
I'm fine. Good evening. Happy
Yes.
Sunday.
Happy Sunday to you, Dr. Israel. Welcome, welcome, welcome. So before you come, I be dey ask our people, make them tell me wetin they understand by menstrual cycle. Somebody say it is the number of days in a woman's period. Another one say the menstrual cycle is a series of natural changes. This person don't go copy internet. It's a series of natural changes in hormone production and the structure of the uterus and ovaries of the female reproductive system that make pregnancy possible. This person go copy, he go copy Google, but he try, he blow grammar. So, Dr. Israel, before you came again, I can't dey give small introduction, waiting be menstrual cycle. So make I hand over to you quickly. Just put mouth inside that one about menstrual cycle introduction. Then we go continue.
Okay. I not gonna make the thing dey difficult. So it's more you make and dey a bit simple. So we just say menstrual cycle now the beginning of a menses to the beginning of another menses. So the time when you take start your first menses to when it take end, when you want to see the next menses, now that will be menstrual cycle. And yeah, there are so many things where they happen within that period. Then that our brother they try to talk when talk about hormone structure and that and that. So those are the things when you add join your own definition. But simply put, from the beginning of one cycle of one menses to the return of another menses, that is menstrual cycle. And so that's a simple introduction for menstrual cycle. So I mean we not for the talk so many things or so many grammar when it comes to menstrual cycle. So in this menstrual cycle, we can't know say we get the one where they normal and we get the one where they abnormal. And we can't tell say a book can't tell us say the normal cycle is between 25 to 30 to 35. Some books will say as low as 21, but when it's 21 days, that's a short cycle though. So some go say 21 to 35 days. So anything when long past 35 days now abnormal cycle. Anything wey low past 21 days now also abnormal cycle. So the normal cycle now between the age of 21 to 35 days. So anybody where they see menses within that period, maybe your first menses you see, and the time when they return are around 21 days or 22 days, you day within the normal range. But if it can be less than that 21 days, that's problem. If it can be greater than 35 days, that's still something and they cause some. Dr. Fred, over to you.
Okay, yes, Dr. Israel, thank you very, very much for that introduction. Before I continue, they make sense if they share this our live session. It means say they support us. How you go they ask us, you go they ask many questions, but one share. Make sense now. Oh yeah, share. Thank you. Now we don't tell you say the menstrual cycle, the normal one, 21 to 35 days. So every woman where they listen to us right now, as Dr. Israel talk, when you see the last period and this other period for this month, when you count and your own day between 21 to 35 days, you dey normal. Some women go think say na 28 days, 28 days. Na 28 days, na 28 days. No. Some people their menstrual cycle na 30, some na 26, some na 32. Now, on the menstrual cycle again, e get many things wey dey make somebody get normal menstrual cycle normal. Number one, make I talk one again, then we'll continue with Dr. Israel. Normal things wey dey make woman get menstrual cycle na wetin we dey call hormone. Because as woman dey for her body so, her body dey produce normal hormone. So those hormone, anytime your body produce those hormone, your body can't release the hormone. You go follow, act on your body, period go come, period go come out, you go ovulate, and that period go come. But you can't get something wey go happen, the menstrual cycle no can't dey normal again. You dey follow me, Abi? So, Dr. Israel, now, when we talk about the normal menstrual cycle, those factors wey dey make woman say her menstrual cycle still dey within normal range. Over to you, Dr. Israel.
Okay, if I get you correctly, we will talk normal menstruation till they form and all that.
Yes.
Okay. Okay. When we talk about the normal menses, our menses stay they form. So from there, now there we'll can talk about the normal the cycle. So this menses formation, now they take almost this 20 this cycle days when be all the hormone work when the hormone they do, and even the body itself and all that, every other part where they responsible for it. Now, a good may we know say for menses to be formed, there are some structure of the female body when need to they patent or they very good. One, now the ovary where egg they form. Two, now the fallopian tube. Now tube when they collect the egg when the egg don't form. So we they call them fallopian tube. Then then the uterus when we they call womb as well. And then the what I call that one, the vagina, where the menses go pass come out. So we need all those structure to make sure say either menses come or pregnancy occur. Now, apart from all this part of the body, we constantly need the hormones. Hormones are very important. And one of the hormones, some of the hormones are brain, now they form from the come. And the part of the brain when the hormone from the come, they call it the pituitary gland. And this gland is the base of the brain. So now they form two of the hormone, the luteinizing hormone and the follicle stimulating hormone. Now, what is this hormone they do now to just help to stimulate the ovary where egg they form. So when the egg don't mature, the fallopian tube go come collect the egg. As it collect the egg, they pass the fallopian tube. Another work of the ovary now to produce hormone, the estrogen and progesterone, will produce estrogen. So this estrogen, this is an hormone. Now this hormone will come go the womb, the belly, can go make the belly look ticking, can give her many power. Now this power when you give her, then there is the lining of the belly. In fact, what did that hormone go do? You go prepare the womb where Peking go stay. You go prepare and clean her plaster the wall, make am dey neat, make am dey strong, solid. So that when pikin enter there, when the egg enter there, e go fit stay there, come grow to become pikin.
Mm.
That's when the egg when don fertilize enter there. So that one na wetin that hormone when the uterus dey produce dey do. So as the egg dey move through the fallopian tube, if the woman knack, the as sperm enter, e fit fertilize the egg and pikin go come. And if pikin come, na that place when the that former hormone don go prepare, na there na the pikin go stay. However, if nothing happen, no knacking or nothing, the egg go come pass, you come enter where the womb, you come scatter. As e scatter, that ovary go come stop to dey produce all those hormone wey dey produce before. As e stop, because that hormone wey dey produce na dey help that place when pikin suppose dey neat well well. As e stop to dey produce am, that place go come still scatter itself. So all those place wey scatter and the egg wey don scatter everything, na all of them go come out when we dey call menses. So menses dey always dey form, dey occur if ovulation occur. So if there is no ovulation, there will be no menses. If there is no ovulation, there will be no menses. So that na one thing wey we need to know. And all these things dey take place within that number of days. Some people 21 days, some people 22 days. But the average, we dey just say 28 days in the average. In the average. But between 21 to 35 days, now all these things wey I don talk dey happen. So once it don happen, as at that very day when e suppose come out, you can't come out as menses. And we know there's difference between menstrual cycle and the menstrual days. And the menstrual days for some people is between the 2 to 7 days. That's when they see their menses between 2 to 7 days. And some people go, most of the people are between 4 5 days, majority of persons. But if person see 2 days, 3 days, 4 days, 5 days, 6 days, or 7 days, it's still dey normal. Okay, Dr. Fred.
Yeah, thank you so much. Welcome. If you just Dr. Israel, check WhatsApp. If you just come, you dey welcome. We dey talk about menstrual cycle, and we dey try break am for you, make you understand, because many women no know about their menstrual cycle. Menstrual cycle just be like you dey travel on a journey. Many things dey happen inside, like Dr. Israel talk. Hormone dey where your body go produce from your brain. Some other hormone dey where your ovary go produce. All these things na to ensure say if you ovulate you meet your oga, belle go enter. So everything dey arrange. Some women no know the time sef wey they're supposed to see their period. Some women no know the thing about their menstrual cycle. And the normal thing wey dey happen, this light don off, no vex. The normal thing wey dey happen be say na your body hormone na im dey control this thing majorly. So if you come dey get problem with all this hormone, something fit happen for your menstrual cycle. We don talk am before, say the normal menstrual cycle na between 21 to 35 days. So some women go dey, they go see their period 30 days. It's okay for them. But if you come dey less than 21, you see your period today, after 15 days, your period come again, matter don happen. Now, make we talk about the things wey fit make a woman menstrual cycle scatter. Something wey fit give woman her menstrual cycle no come get head, come dey normal. Wey be say even when the menstrual cycle no come dey normal, e fit come still affect her ovulation. She no go come know wetin dey happen. Her period sef fit scatter. Many things. Now, the first important one, as we dey talk, we go talk about some kind normal things wey fit make woman menstrual cycle be like the menstrual cycle don dey, e wan dey change small small. Normal one first. Make I talk about normal one small. Normal one na age. E get how woman go dey, she go don dey comot for the age wey they go see period. She go don dey near menstruation. Wetin dey call am menopause. The woman don dey near menopause. Her menstrual cycle. Menopause, yes. Her menstrual cycle go come dey scatter small small because she don dey comot for that age wey menstrual cycle dey normal. So when the woman don dey near menopause, perimenopause like this, her menstrual cycle no fit get head. You dey follow me? And that thing wey fit make woman no see her menstrual cycle, that is she no go see period sef, na when she carry belle. When woman get belle like this, pikin dey inside the woman uterus, pikin dey grow. Period no go come now because that place pikin don dey inside, visitor dey there. So your uterus is taking care of the pikin, make the pikin dey grow. So period no go come out. Because if period dey come out, e mean say you wan comot the pikin. Do you understand? So na normal thing wey go make woman no see her menses, her menstrual cycle go break. Another normal thing again wey fit also do woman wey be say her menstrual cycle go come get small travel, go just travel small. Na woman wey be say dey breastfeed pikin. Some women dem dey breastfeed their pikin like this. As dem dey breastfeed the pikin, their body go come release another hormone. That hormone wey their body go release when dem dey breastfeed pikin, that hormone go tell their body say, "Madam, we no wan see period now. We dey feed pikin." Though no be for every woman, because some women too, they don notice say e get how dem go dey breastfeed like this. Somehow dem fit see small period. But commonly, you go hear woman go tell you say, "I dey breastfeed my pikin 6 months, 7 months, I never see my period." Na that breastfeeding make your menses and your menstrual cycle travel. I just put mouth talk about this small one. So I wan hand over again to Dr. Israel, make we continue and tell you about those small other things wey fit make your menses and your menstrual cycle wey fit make am travel. But if you never share this live session, you no dey support us. Oya, abeg, share this live session, make more people come on lis ten. Dr. Israel, over to you.
Okay. Another thing when dey normal, when they fit cause irregular menstruation, na menarche. When person dey see e join the age part, when person dey see the menses for the first time. So for young people, when they see their menses for the first time, sometimes when they see am this month, they may not see it again for like 2 months before they'll see am again. So e go give them irregular menses. Sometimes e go even make their menstruation long and more than normal. So that na say another normal thing. After some times,
Good.
it go regulate itself. So
Mm,
another thing when we dey do now, things when we dey do or some other part of abnormal things when fit cause menstrual cycle. One, and the use of family planning. So when we dey use people wey dey use family planning, most of the time, e dey also dey, for some persons, e dey also dey touch their menstrual cycle. Some no go see their menses during the period of using the family planning. Some their period, the time when they'll take see the menses go long before it go stop. And just like that, some people go see am this month, they no see am next month, they'll see am the following month, just like that, because they use family planning. So those are say another say. Some people will take some odd medication, some medication, also those family planning medication, maybe those way one after they don't do some things, they just want to take medication, make pregnancy not come. If it still alter their menstrual cycle, if it still
mm,
alter am. Then another one problem when it cause an polycystic ovarian syndrome. And
mm,
some people will get issue with their ovary and their uterus. They fit get irregular menstruation. So polycystic ovarian syndrome are one of the things. Then another one now people will get fibroid. So for fibroid case, in some cases, if you make the person menses dey long, and also if you make them see this month, not see next month, if it cause a lot of pain following menstruation. So
mm,
fibroid na say one part of it. Another thing na people wey get endometriosis.
mm,
Endometriosis na the inside part of the womb. They can't see am for other part of the they can't see am for other part of the body. So you can't see say this person they bleed more than normal. Sometimes if you just dey
mm,
bleed for 2 months, 3 months, and so on and so forth. So endometriosis, all these ones when I mentioned, so all these ones are problems. Endometriosis, adenomyosis, now still the same thing like endometriosis. So cancer of the uterus or of the ovary can
mm,
also cause irregular menstrual cycle as well. So another thing when go physical cause an weight loss or weight gain. People wey dey
Mm,
obese, some of them they also they get irregular menstrual cycle. When we dey talk about irregular menstrual cycle, it can either be too long or too short, or you never see am.
mm,
So obese can actually get it. Underweight, even the body they control everything. So when the body notice say your weight not reach when you go take
mm,
see menses, you know, the person fit not even see am. And so they also hinder that. So people when see get problem with their thyroid gland, the thyroid gland and
mm,
one gland when they the neck. Eh?
mm,
People when get problem with the thyroid gland, hypothyroidism, they go feel they get, for women they feel they get menses where they long well. Eh? So these ones, I think I don't mention many things. I don't even forget what I mentioned. So these are some of the things when fit cause irregular menstrual cycle.
yeah, thank you so much,
Dr. Fred, if you remember
Doctor.
anyone, you fit add.
Yes, yes, yes. I thank you so much, Dr. Israel. If you just they come, we they talk about the menstrual cycle, and I do see some questions. No worry, we go take your questions in the next 5 minutes, 5 or 10 minutes. If you get question for us on the menstrual cycle, you go take them. But I beg everybody, share this video. The more you share, the more you they support us, the more you they encourage us, the more you want more people to come and learn. Hmm? Yes, thank you. Now, Dr. Israel mentioned something where they very important. Some women no know say even their weight now if it be the problem with their menstrual cycle. Most times they go they find medicine. Doctor Abego, which medicine make I drink? My period don't travel. I never see. I don't know where you go, madam. But what is your BMI? You don't go gather weight past normal, or you don't go lose weight too much past normal if it be the thing where they happen to you. Then one other thing again, maybe Dr. Israel talk about some hormonal imbalance. Remember, we mentioned in the beginning, say your body need hormones. Those hormones, and those hormones they go they follow your body talk, your uterus, your ovary, say make we arrange. But you get some women, when those hormones come scatter, no be one hormone, no be two hormone, no, na different hormones. So when any of these hormones come scatter, no come balance, if it affect the woman period, maybe say the woman no come see period. Another thing wey fit make woman no see period na severe stress. Example,
Yeah.
e get some women wey dey work for our environment. Early morning you don wake up,
Excessive
you
exercise.
don go baff, enter motor, you dey go office, you come back very late. You are so much stressed, and this stress go come dey make your body produce another hormone. That hormone go affect your period. Another one na exercise. Yes, excessive one, no be say exercise, excessive exercise. E get some babes, oh baby, I no know the kind exercise wey you dey exercise, you come dey do am pass normal too much. Next thing your period don travel, otilo, we no see period again, you come dey vex, not knowing that na you even dey cause am. You dey follow abi? Good. Now we don mention some of the things. Dr. Israel mentioned medicine, family planning. E get some other medicines too wey no be family planning, wey some women fit take. Those medicine fit affect their menstrual cycle. That is why we dey beg you, madam, and even you, oga, don't just see any medicine or take any medicine on the internet and drink because you hear say e go make this one happen to you. That medicine fit give you problem. You dey follow us, abi? Very, very good. Now, we wan take your questions. So if you get question for us on the menstrual cycle, because we don touch, e deep well well, e big well well, but we don touch. Now, if you get any question for us, abeg put am in the comment section, so that we go answer you. But remember, we no go treat you online, no. We no go do diagnosis for you here, no vex. If na to clarify something for you, we go clarify am. But if you dey find treatment for here, no, you go need to enter hospital. Is that okay? Very good. Dr. Israel, you get anything wey you wan add before we start to take questions?
Okay, before you start to take question, I noticed that we dey talk hormone, and I believe say person will want ask say wetin be this hormone. So
Mm.
make I just give a layman definition of hormone. Wetin be hormone? Hormone this one are chemicals when they our body, when they help us regulate every aspect, everything wey dey happen for our body. Now those chemicals na dey regulate am. Now they go tell every part of our body wetin they need to do and wetin they not need to do. Some part of our body, in fact, every part of our body, wetin they need to do and wetin they not need to do. If you even to the extent of sweating, even to the extent of cold dey catch you, these hormones, different hormones, now they do all these functions. So hormones are just chemicals when they the body, when they help us, they do all the regulations, where they happen for our body. Just the way when those the menstrual cycle, cause it get their own hormones, where they help us, they regulate everything where they happen within the menstrual space.
Yes, thank you so much, Dr. Israel. Now we want to take your questions on the menstrual cycle. So may we see how many we go fit take. You get one question where I see for here. This question say, "Good evening, doctor. Please, is it normal that one's menstrual cycle changes in each month? Is it normal?" Okay. Dr. Israel, I beg respond to this one.
Yes, the answer now, yes, it is normal. So far, they within this normal cycle length when we talk within 21 to 35 days. Because sometimes activities when we they do as well feel also change our days of cycle of menses. So
Mm,
if it dey within those normal length when we talk 21 to 35 days, even though maybe you dey see am every 25 days before, or every 27 days, and the next day you come see am 30 days, it's still within normal. So na normal thing. Sometimes some stress when we do, sometimes some activities when we do within that period fit actually change the day. Some people anxiety fit even change am within that period. Too much of excitement, you are very happy or you are even very sad. All those things fit even change your hormonal, fit cause hormonal imbalance, and e fit alter your menstrual cycle within just within that period. So when you dey see am different dates, na normal thing. And also note say you see am today 10th does not mean that you go see am next month 10th. It's all about the length of your cycle. Because if you see am 10th and your cycle na every 21 days, from 10th to 21 days, if you count 21 days join from your 10th, it may not get to 10th the next month, and it may not be like that all the time. So you can't make
mm.
sure say you can't make the dates when you dey see am they change every minute. So that na say another thing.
Yes, yes. Thank you, Dr. Israel. You say we don't hear is correct to if your menstrual cycle last month 24, this month 26, it is still normal. Most women would expect their menstrual cycle to be the same number every month. No, oh baby, your body they change and little things they happen to you different months, and it is still normal. Please, at what age does menopause set in? Can irregular menses be corrected if it is caused by medication? Oh, yeah, may I answer the second one? May I leave the first one for Dr. Israel? Can irregular menses be corrected if it is caused by medication? The answer na yes. How? The how na there matter come tie wrapper. Because we don't even know which medicine you dey take. We don't know who give you. We don't know how long you don't dey take them. But the most important thing now, if that medicine they cause irregular menstruation for you, it go good make your doctor look the medicine. Now better medicine where your body need. If now better medicine where your body need, can we change it to another medication where no go affect your menses? If yes, we go change them. If your body does not need that medicine, your doctor go stop am for you. If now medicine where doctor no give you, where you just go collect by yourself, the advice now stop am. Do you understand? So the answer is broad. Many things they will go consider. Oh, this medicine, oh, you need them more. We cannot change it. Can we reduce the dose? So many things they involved. That is the how. Concerning medication. So we go look many things to take consider how to help you manage them. Ma allow Dr. Israel respond to the first one. At what age does menopause set in? Okay, Dr. Israel network don't spoil. So ma I tell you. Now listen, averagely for most women, they go see their menses around their menopause around 52 years, around that age for most women. Some women can enter menopause even before that age. Oh. Some can enter menopause after 52, 55, 58. Yes, I don't see woman. She still they see her period 56, 57, 58. But most women, when they enter that 51, 52, their period, it don't stop. They come again, 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 again. Some women fit see am earlier than 52, 50 years, 48 years. Sure you understand? Now, somebody is asking us, I beg now, if you never share this video, why now? As I dey talk, so we dey get headache, make I not lie you. We dey use energy talk to you. So help us share this video. Oh yeah, share, share, share. I dey wait for you. Oh yeah, share. Thank you. What about people that their menstruation did not flow very well? And that one too, now to find out wetin cause am. We don't answer before. When woman dey near menopause, her period fit no flow well. Some women fit drink medicine, the woman period no go flow. She go just make her period. But most importantly, as a woman, you need to know how many days your period dey flow. If your period dey flow for 6 days, it's normal. When you see your period today, e go last for 6 days. Some other women na 4 days. But if your period na 6 days, 6 days, then suddenly your period come enter 2 days, only two days. Something don't happen. No, we don't know wetin cause am. We need to find out. That finding out, you go enter hospital, make dem check you. But if you dey see your period, when your period starts, na 2 days, 2 days, 2 days, 2 days, 2 days, it's okay for you. If you dey see your period 3 days, 3 days, 3 days, 3 days, normal for you, fine. Some other people, 5 days normal for them. But if your period now 5 days, 5 days, 5 days, suddenly your period come enter, now 2 days, 2 days, it don't change. Na that one you go need to see your doctor. Okay, let's take questions. We want to work with time. We have a question for Israel. Is it good to take
Yeah.
medication to calm down menstrual cramps? Is it good? Is it advisable? Oh yeah, let's go.
Okay. There are many school of thought on this issue. Some school of thought believe say you fit take medication and no problem. Some say there's no need. However, the thing is that no say menstrual cramp they very painful for some people, and for some people it's not actually very painful. So if your menstrual cramp they very painful, you know that it's very painful, you can't bear it. I beg, take waiting go reduce the pain. But note, e no go stop the pain, e go only reduce the pain, yeah, to some extent. And other things dey wey you fit still do to actually reduce that pain if you also no wan take medication, because also most medication when you go take fit change your menstrual cycle to small, fit change am small. Now other things wey you fit still do, there are some exercise that you can do and wey go still help reduce the pain. And so if you no want take medication, do some exercise, waist exercise. It go also help to reduce the pain. So it's not everything you need to actually take drug for.
Hmm. Yeah.
Dr. Fred.
Okay, thank you, Dr. Israel. We get many questions, though. And make I add something too. If you know, madam, say whenever you dey on your period, the pain where you dey feel, the pain be like it won't buy you. It dey too much. You know if you bear am. Now so your own be. I beg you. That thing no dey normal. They go need to find out what they happen. This is why you have to see your doctor. Most especially, try to see a gynecologist. You're not supposed to day on your period, make the pain, make the pain one off you. Make it be like say your enemy don't sit down for your head. No. So if you know say your pain dey too much anytime you don your period, e too much, you must take medicine. Ha, abeg o, make dem check you to find out wetin dey happen to you. Okay, we get many questions, but we dey try work with time. What age is good to start menstruation? What age?
Okay, and these days, because of the lifestyles, because of so many things that is really happening now, things don't dey change. Children now don't they mature before time. So most of the time in those days we go say between the age of 10 to 14 years, but I think that age don't they drop small to 9 years, to 9 to 14 years. But if you did within that range when I just mentioned between that age of 10 to 14 years, it's just the best time to see your menstruation. To start. Yeah.
Okay, now for those who just dey watch this live session, na your first time be this. This program, we dey call am Ask the Doctors. Na every Sunday by 8 p.m. Nigerian time, 8 to 9 p.m. We don dey do am for over 4 years now. 4 years dey come every Sunday. Here you go find us here. Here we teach, we answer questions. But abeg, we no dey prescribe medicines, we no dey make diagnosis, we no dey treat for this page. If you come here, we no go treat you. We always beg you, make you go hospital. But we dey here to teach you, to make sure say you understand things about your body. If you never share the live session, you know dey support us. So many people never share, and sometimes I wish I can see the names of those wey dey share. Maybe na only them we go answer because the rest people they no send. Now wow. Okay, is it possible to see your menses without ovulating? Veronica, it's possible. E get wetin we dey call anovulatory cycle. Some women fit see period, but dem no go ovulate. Though e no common, because most times one rough way to know whether woman dey really ovulate, her everything dey okay. Na if you dey see your period regularly, there's a very high chance say you sef you dey ovulate. But if your period dey irregular, your period scatter, you no even know wetin dey go on. It's supposed to come this day, you wait for like 3 weeks before you come scatter, there's a chance say you might not also be ovulating. But if your period they come regular, as everything dey within normal range, there's a very high chance that you are also ovulating. Hmm? Yes. Let me see. Dr. Israel, is
Yeah,
menstrual pain.
Dr. Fred, sorry,
Okay,
before you ask.
okay. Go ahead, go ahead. Respond.
Okay, before you identify for that anovulating and that anovulatory menses, now one set of people where they get on like normal now, those where you start to see their menses newly, those young people, when they that's what we call menarche as they start. That first menses, the first two menses is there's no ovulation in that measles. The egg not they form
Mm,
that for that measles. And another people will see they could get that type now. Those when they use when they on family planning, when they see their measles. Because most of those family planning they stop ovulation. So whatever
mm.
measles when they see, they are all an ovulatory menstruation. So just know that that's just for those that person will ask that question. I'm waiting Dr. Fred talk all of them. Now so they join together.
Okay. Yes, you're welcome. You're welcome. You get one thing where we want to talk, but I be don't forget. Yes, if you want to sponsor this program, we don't ripe reach the age where we fit get sponsors now. So if you want to sponsor the program, you want to put an advert, there's the email on your screen. You can send a mail there. Many questions they here. Oh God, I beg you. Okay, let's try. Is menstrual pain normal? Dr. Israel, want to respond to that?
Okay, now menstrual pain they different as Dr. Fresh talk. There are some that are very severe. You need to see your doctor on that. Mostly when the menstrual pain, the first day before the menses, you feel and the second normal menstrual pain. Suppose for the first day it go pain you. By the second day, the pain go down reduce well. By the third day, you're not supposed to feel pain again. However, if you can't dey feel pain from the beginning of your menses to the end of your menses, then there's a problem. And there's a
Mm,
problem. And wetin dey really cause this pain na just the how your womb take dey contract, that is take dey contract. I no know the pidgin English word wey I go use for that. Take dey contract, take dey squeeze himself so that make the menses come out. Na
mm,
dey cause that pain. So from the first time e go that very first time na dey squeeze himself well well. But after that first time, the pain go reduce. While for some people e go even stop. So but if you come dey see if that pain still continue, persist the second day, the third day, you need to see your doctor. But if na for just that first day and it's not very severe, na normal. But if it's very severe, you still need to see your doctor.
Thank you, Dr. Israel. We have a question here. What makes a woman see her menstruation 2 times in a month? Dr. Israel, I better respond quickly.
I dey expect this question since and e still come.
Mm,
Now we remember
yes.
we talk say some people menstrual cycle na between 21 days to 35 days. So if your cycle is 21 days, there's every tendency say you fit see am 2 times in a month. And mind you, seeing your mens is not be monthly thing. It's not a monthly flu. Menstruation is not a monthly flu. So it's about the cycle. Now the cycle we take the count am. So it simply means that some people can see it 2 times in a month. Some persons can even see it once in almost 2 months. Once in
Mm-hmm.
almost 2 months. So if person see am on the 30th of 1 month and that person dey get 35 days cycle, the next month you fit no even see am throughout that month until the upper month again before you go see am. So some persons can have it that way, while some persons can have it 2 times in a month if your cycle na within that 21 days and to 25 days or even 28 days, you may likely see it 2 times in a month and it's normal. However, if it's shorter than that, na there wahala come dey. If it's shorter than 21 days, na there wahala come dey.
Okay, those on YouTube, your questions are not coming. Why? Good evening. Please, what can make someone that used to have 5 days menstrual flow to reduce to 2 or 3 days?
So the first thing we want to know, how old are you? And so that may also guide. If you don't go get to your menopause, things will happen that way. Also, we also want to know the part when you they use for that 5 days and see the same thing you they use for these 3 days. If not see the same thing, you may not want to disturb yourself. Another thing, we want to know your activities. Have you changed your activities? Are you not stressing yourself too much? Remember, we say stress can actually cause problem with your menstrual cycle. Another thing we want to ask whether you dey on any medication, because there are some medication that can change your menstrual cycle. They can change your number of days when you dey even see your menses. And we want to know say you just newborn, when we say you just the new one start to dey see your menses again. So these are a few things wey fit just change your menstrual cycle. And another one, there might just be a problem within the uterus. So if you can't notice this, and you are not comfortable with it, please see your doctor. And the doctor you need to see, gynecologist, doctor where they specialize in women.
Can a prevention
Dr.
pill,
Fred.
yes, can prevention pill change the menstrual cycle?
Yes. The next question.
Okay. Let's see. There's some questions that they ignore, beg. Okay.
I understand.
How many days way period supposed to last? We don't answer this thing. I just have to take it. We don't answer them in the beginning. Period. Now within 2 to 7 days for some women, their own will be two. We don't talk about them from five. Period between 2 to 7 days. Some women go see their period 7 days. It's normal for them. Person wey see period on 25th of a month, I beg, when the person fit ovulates. We can't calculate ovulation for you because you don't even know the length of your menstrual cycle. Huh? Yes. Somebody say we should explain ovulation. That one is a different topic altogether. We dey try maximize time. We have about 10 minutes more. Anytime I take antibiotics, it affects my menstrual cycle. Why is it so? So Israel, want to respond?
You just remember, say we talk, say some medication can actually affect menstruation. So
Mm.
the question now is, why are you even taking antibiotics? Why must you take antibiotics? If you notice, say you not really get reason to take antibiotics, don't take it. But except there are good reasons, and those antibiotics are prescribed by your doctor, not be you just go take antibiotics. If it's prescribed by your doctor and there are reasons why you are taking it, then it's fine. There's no problem. As far as just for that short period of time. Um,
Okay, what happened when you see your menstruation and ovulation and yet no pregnancy coming? Oh God. Dr. Israel, I beg, no verse.
okay, when you see your menstruation and ovulation, the first thing is that, do you even know when is your ovulation? That's the first question. If you don't know when your ovulation be, you may end up not become pregnant, because if you go knock outside your ovulation time, you not go get pregnant. No matter how good and how many style the man use and you use, you not go get pregnant. It is when you knack within your ovulation period, that is when you become pregnant. So ovulation most of the time is just one day. It's a one day
Mm-hmm.
with in
Mm.
your menstrual cycle is a one day within 24 hours. So if you miss out within that 24 hours, you have a grace of another, let me say, another 24 hours. When you miss out within that period, you don't miss and be that. You don't miss and be that. It, till the next till the next cycle. So the first thing is, try and know your ovulation. Try to even know if you dey ovulate before you go. And when you don't know your ovulation day, then try to make sure that your sex is within that period. Then you may likely become pregnant. Now there are so many factors that can affect that too, but not before this live session we go fit talk all that.
Mm-hmm. Mm-hmm. We dey work with time, so we're trying to be very fast. We have less than 10 minutes. Good evening, doctor. Can blocked fallopian tube prevent ovulation? No. A blocked fallopian tube will not prevent ovulation. Um, why is it that if you want to see your period, you will be having symptoms of pregnancy, and at the end, your period will come out?
Because now those hormones when they guide the stomach, they prepare, I say the stomach, when they prepare the womb, eh? Now all those ones they give you those symptoms when you they see. So once those hormone don't they go, those symptoms go.
Okay, so let me respond to this one. Thank you, Dr. Israel. What I meant is counting the days. Like this month, it comes after 28 days. Next month, it comes after 30 days and thereabout. Yes, which is normal. 28 days. If this month you count, your period come after 28 days is normal. Another month, it comes after 30 days. It is still normal. Your period will not always be coming after every 28, 28, 28. Do you understand? Because many things can happen to your body normally, and these are fine. But most women expect that if I see my period on the 1st of January, I must see my period on the 1st of February. I must see my period on the 1st of March. No. Oh, my period na 30 days. So after every 30 days, I must see my period. No. My menstrual cycle is 30 days. There are some other things that can happen. It can be 28 next month. It can be 29. It can be even 32 or 31. It is still within normal. Now we try explain to you. All these things, they're very deeper, but we dey try. Um, okay, there's a question here. Why a woman see her menstruation? I believe this is menstruation 3 times in a year. Why women? Okay, I beg, respond, I beg.
And that one, the person need to go see doctor. That is part of irregular menstruation. So you need to go see doctor. If they see am 3 times in a year, you need to go see doctor. Let them know why it's like that, and treat if there's any reason to treat the person.
Okay, yes, yes. It's not normal to see your period 3 times in a year. That is not normal. You don't fall outside the normal range. Doctor, can surgery affect the flow of menstrual cycle?
It depends on the kind of surgery when you do. It depends
Mm,
on the kind of surgery. If it's a surgery that affects the uterus, the womb, and all those places, yes, there's every tendency that it can affect it. But if you not concern the reproductive organs, you're not supposed to affect them.
okay, we are almost out of time. Well, I'm trying to be very fast. How many days does ovulation last? 24 hours.
Okay, sir. Ovulation is
24
just
hours.
1 day. It's just
Now,
one
one
day.
day. One day.
It's a 24 hours thing.
Ovulation now one day, 24 hours. Ovulation itself. Is there a sign of ovulation? Yes, but that's not what we are talking about today. Let's see. Okay. So we don't answer all the questions. There are other questions here I they ignore because those questions are not directly related to the topic tonight. If we answer them, we go need to kind of go deeper and deeper. Do you understand? Yes. But we don't answer the questions where they related to the menstrual cycle. Dr. Israel, let's do a brief recap as we round up tonight.
Okay. Yeah, before we do a brief recap, I will just say this for everybody when they ask question on ovulation, and it's just like you are telling us to do like a part B, eh?
Hmm.
Because this menstrual cycle also actually lead to ovulation. So maybe by next week, you guys should just get ready. We go talk about
Okay.
me and Dr. Fred
Yes.
go
Yes.
put it
Ma talk
together,
something.
see if we go fit talk about ovulation by
Okay.
next Sunday.
Ma
And
also
by
talk
next
something as well.
Sunday, we'll put it together to see. Okay.
Yeah, ma talk something. So with regards to this ovulation as well, so we will talk about ovulation next week Sunday. But most importantly, I go try post one video this week. So everybody watch the video so that when we dey do our live session on Sunday, maybe you watch the video and e no clear as well, and we dey explain more, you go fit understand. So automatically we will talk about ovulation, but I go try post one video this week. So you go watch the video, and then any question wey you get, you go ask us when we dey live next week Sunday as we dey explain further. Is that okay? Dr. Israel, over to you.
Okay, that's fine. Yeah, what we talk today, we talk about menstrual cycle, and we say menstrual cycle now, the beginning of one cycle, one menses to the return of another menses. So when from the day when you start to dey see your menses to when it end, when another one come, now that one form a cycle, a menstrual cycle. I would say there are so many things when they happen within that cycle when they bring about menses. So we explain how menses stay they form, which we will not be talking now, and we can also talk say even the brain get function to play, and we get what we they call hormone. These are chemicals when they help regulate the body, and even for menses to be formed, these chemicals also get their own role when they play. We now say a normal cycle is within 21 to 35 days. So if your cycle is less than 21 days, now wahala. If it's greater than 35 days, now wahala. So all those ones are called irregular menstrual cycle. So we also list things wey fit cause irregular menstrual cycle. We say there are some normal things that can cause it, and there are some abnormal things wey fit cause am. And some of the normal things na pregnancy, age, those wey dey enter menopause. So before you enter menopause, and wetin be the age for menopause na between the age of 45 to 55. So before you get to that 45, you go notice some changes in your in your menstruation, and that one can take place within 5 to 8 years even before you get to menopause. So when you don dey notice some changes, just those are irregular menstruation. So and then we can still talk say for menarche dem fit still get irregular menstruation. Then the abnormal things come be people wey get problem like fibroid, wey get endometriosis, and so on and so forth. We talk about excessive exercise, we talk about excessive stress. All those ones go fit cause irregular menstruation. So from there we try those wey still dey use contraceptive. Yeah, we fit get irregular menstruation. Then we can't talk small about uh menstrual cycle when menses wey fit occur when ovulation no dey, and when ovulation no dey wey no occur. So and we also said that there can be things that can make it normal, and there are some abnormal ones. So anybody wey get any problem, say e never get belle and e dey see menses well well and all that, we advise that e go see a doctor, a gynecologist, wey fit make am put am through and let am know wetin e need to know. After that, we answer questions, and now we want to call it a day.
Yes, thank you
That's
so
just the
much.
summary.
Yes, thank you so much, Dr. Israel. Thank you, oh baby. Thank you for watching. Thank you for sharing. My guy, thank you so much for watching. We appreciate you as you watch us, as you ask, as you share the video. We appreciate you. Now, we don't promise you. Say next week, Sunday, by 8 p.m., we go talk about ovulation. This program, we don't dey do am for more than 4 years, every Sunday. Me and Dr. Israel. Now, so we dey do am. God, now they help us. We dey here, they do am. So no miss next week. Because if you come late, you will miss a lot. Thank you so much. Dr. Israel. Oh, yeah, now you go greet them.
Yeah. I want to say very big thank you to everybody. When you join us and they listen to us. Another thing when I talk is, for us within Nigeria, we notice that the stress this period don't increase. Please, I beg, not react to everything when you see. Not be everything when person talk you go react to. Guide your mental health, guide your physical health as well, because stress not be beans. It dey collect life. And recently, everybody feel bear me weakness. Say the way when people take they die this period, it don't increase. Before you know wetin dey happen, you hear say this one don't die. So this is now make me say, make I tell you to guide your mental health, guide your physical health as well. Don't react to everything. Not vex because person talk one kind. You don't know what to make that person talk like that, because the thing still touch that person. I make am talk like that. So guide whatever you listen, guide the way you react to whatever you listen, and guide your mental health. Very important.
Thank you so much. For all the new followers and the new people we join us today, you dey welcome. Thank you very much. No miss the next Sunday program. No come later, beg. We dey very conscious of our time. Thank you. I can always tell you, good life now waiting. Good life. Oh yeah,
That's it.
everybody put in the comment section. Good life now waiting. Good life na sense. Thank you and have a wonderful day. Bye bye. Dr. Israel,
Bye bye.
you too much. You too much.